Water is probably the origin of life and one of its conditions. 71% of the Earth's surface is covered by water. Together with temperature, it is the most important environmental factor for life on Earth. Up to 60 to 70% of the human adult is water. Our bodies need water for intracellular transport, excretion of metabolic products, or the regulation of body temperature and many other functions. Surviving without water is impossible. Did you know that during mechanical ventilation, the supplied air is typically cold and dry, which can lead to diverse problems for the patient? Mechanical ventilation using cold and dry gas can lead to a degradation of gas exchange due to changes in lung compliance and air-water patency. Ventilation with cold and dry gas can lead to a slowdown of the mucociliary transport and a higher infection risk. When we breathe in, the upper airway and respiratory tract are responsible for humidifying and heating inspired air, a process defined as conditioning of inhaled gas. Coughing, sneezing, and mucociliary clearance clean the upper airway. Mucociliary clearance is the self-cleaning mechanism of the bronchial tubes. For adequate mucociliary clearance, your body needs the right quantity and density of cilia to work effectively. This includes sufficient humidity of the ciliated epithelium for improved clearance function. When the critically ill patient is mechanically ventilated, for example with an endotracheal tube or tracheostomy cannula, the upper airways are prevented from performing their proper function of humidifying and heating inhaled air. Moreover, the patient's condition worsens when cold and dry medical gases are administered during invasive and non-invasive ventilation. Wouldn't it be better for the patient to directly receive moistened breathing air? For this reason, a gas conditioning device is needed, as it helps to avoid structural and functional damage to the respiratory epithelium. This device consists of a gas supply, heated breathing circuits, a humidifier, and a patient interface. The cold and dry medical gas is warmed and humidified to optimal conditions in the water chamber. Heater wires in the heated breathing circuits maintain gas temperature at 37 degrees Celsius or higher to avoid condensate in the inspiratory limb. Consequently, the patient inspires gas at optimal conditions. During expiration, the exhaled air travels through the expiratory limb of the breathing circuits. In this case, the expiratory limb is unheated, the exhaled air will cool down, the capacity to hold water decreases, and condensate occurs. Active humidification can be administered either in intubated patients or during non-invasive ventilation, as well as providing breathing supports to minimize airway drying. This therapy is especially beneficial in the NICU as it helps to reduce infection risks, work of breathing, and airway resistance in infants. The use of active humidification helps to improve gas exchange efficiency, decrease work of breathing so that patients can breathe easier and tolerate therapy better, reduce the risk of infections by supporting a natural breathing mechanism, and prevent long-term lung damage and enable lung protective mechanical ventilation. Active humidification can be a magnificent contributor to enable a lung protective ventilation. Learn more about active humidification on Draeger.com.